I have watched administrative boundaries harden into something else before, not through legislation that announces itself, through procedures that accumulate quietly until the threshold has already been crossed. February 2026 marks the implementation date for what federal transportation authorities are describing as updated driver fitness protocols. The language is careful, the framing is measured, renewal procedures, health assessment standards, age-correlated evaluation frameworks. Nothing in the regulatory text uses the word restriction. Nothing in the public guidance suggests prohibition. But I have studied how systems translate authorization into practice, and what I am seeing in the procedural architecture being constructed right now is not a rule change. It is the installation of a discretionary apparatus that will operate long after the initial justification has been forgotten. The public presentation is straightforward enough. Beginning in February 2026, license renewal processes in 47 states will incorporate what the Department of Transportation is calling Enhanced Fitness Review Standards. For drivers aged 65 and older, this means additional documentation during the renewal cycle, medical clearance forms, vision certification beyond standard acuity tests, cognitive function attestations signed by licensed physicians, reaction time assessments conducted at state facilities. State motor vehicle departments have been instructed to establish what are being termed age-specific renewal pathways. The terminology is neutral, the implementation varies by jurisdiction, but the structural pattern is consistent. Create a separate processing channel, require additional steps, introduce evaluation criteria that did not exist in the previous system. Call it safety modernization. According to early compliance estimates from the American Association of Motor Vehicle Administrators, approximately 54 million Americans currently hold driver licenses and are age 65 or older. Of those, roughly 19 million will face renewal cycles that fall within the first 18 months of the new protocols taking effect. That is not a small pilot program. That is the largest simultaneous administrative reclassification of licensed drivers in the history of the United States motor vehicle system. The federal guidance framework was finalized in November 2025 through a joint directive issued by the Department of Transportation and the Centers for Medicare and Medicaid Services. It was not passed through Congress. It was issued through existing regulatory authority under the Safe Streets and Roads Act of 2021, which contained a provision allowing federal agencies to establish minimum safety standards for state licensing programs. That provision, buried in Section 7, Subsection 4, Clause C of a 1,147-page omnibus transportation bill, granted rulemaking authority without requiring subsequent legislative approval. This is how structural shifts embed themselves, not through visible confrontation, through jurisdictional gaps that no one noticed were being widened. The stated justification is mortality reduction. Federal Highway Administration data shows that drivers age 75 and older are involved in fatal crashes at a rate 4.2 times higher per mile driven than drivers age 35 to 54. The numbers are real. The pattern is documented. But what I am tracking is not the validity of the safety concern. What I am tracking is how safety concerns become authorization for permanent monitoring infrastructure. The Enhanced Fitness Review Standards include a reporting requirement. Physicians who complete the mandatory medical assessment forms must submit their findings directly to state motor vehicle databases. Not to the driver, to the state. This creates a parallel verification system where medical professionals become compliance checkpoints in an administrative chain that the driver does not control. If a physician notes any condition on a list of 47 specified health markers, ranging from diabetes to sleep disorders to medications that affect cognition, the state system flags the renewal application for secondary review. Secondary review does not mean automatic denial. It means discretionary evaluation. And discretionary evaluation means the outcome depends on how the evaluating official interprets guidelines that are intentionally written to allow case-by-case judgment. According to internal training materials distributed to DMV staff in California, Arizona, Florida, and Texas, the 4 largest states by senior driver population, officials are instructed to consider not just test results, but the totality of circumstances, including driving history, incident reports from law enforcement or family members, and patterns of prior renewals. That last phrase is worth sitting with. Patterns of prior renewals. It means the system is designed to look backward across your entire licensing history and identify trends that suggest declining fitness, even if no single event would justify restriction. It transforms every previous interaction with the motor vehicle system into evidence that can be reinterpreted under new criteria that did not exist when those interactions occurred. This is not speculative. I have reviewed the procedural manuals. The language is there. In 17 states, the new protocols also introduce what are being called conditional renewal designations. A driver who meets most, but not all evaluation criteria can be issued a license with geographic restrictions, time of day limitations, or passenger requirements. The license remains valid, but its scope has been administratively narrowed. The The restriction is encoded in the state database and is enforceable by any law enforcement officer with access to the system during a traffic stop. Florida's implementation guidance specifies that conditional licenses may restrict driving to daylight hours, only limit travel to within 25 miles of the registered address, or require the presence of a licensed driver aged 25 or older in the passenger seat. These restrictions can be imposed without a hearing, without legal representation, and without an appeals process that functions outside the same administrative structure that made the initial determination. The driver is notified. The driver is not consulted. According to draft assessments from state budget offices, the administrative cost of implementing enhanced fitness review standards is estimated at $1.8 billion over 3 years across all participating states. That figure includes facility upgrades, additional staffing, database integration, and training programs for medical providers who will be conducting the mandatory assessments. The cost is not being absorbed by general transportation budgets. It is being offset by increased renewal fees. In California, the standard license renewal fee is increasing from $39 to $89 for drivers subject to enhanced fitness review. In Texas, the increase is from $25 to $78. In New York, from $64.50 to $140. The fee is structured as a processing charge, not a tax, which means it does not require legislative approval in most states. It is classified as a cost recovery mechanism under existing administrative fee authority. So the driver pays more to submit to a process they did not request, conducted under standards they did not vote for, with outcomes determined by officials whose decisions are insulated from direct accountability. And if the outcome is restriction or denial, the driver pays again to appeal within the same system. This is a revenue-generating compliance structure disguised as public safety administration. The timeline is accelerating faster than public awareness. Between now and February 2026, state motor vehicle departments have been instructed to complete database upgrades that will allow real-time cross-referencing between renewal applications, medical provider submissions, and law enforcement incident reports. According to technical specifications I've obtained from vendor contracts in 6 states, these systems will include automated flagging algorithms that assign risk scores to renewal applications based on weighted criteria, including age, medical history, prior violations, and geographic crash data for the applicant's zip code. A driver in a high crash density area will be scored as higher risk even if their individual record is clean. The system does not evaluate you in isolation. It evaluates you as a data point within a risk pool. And if the pool's aggregate metrics exceed preset thresholds, everyone in that pool faces enhanced scrutiny. If the current trajectory holds, the first wave of renewal denials and conditional licenses will begin appearing in April 2026, approximately 60 days after implementation. Based on denial rate projections from pilot programs conducted in Oregon and Michigan during 2024, early indicators suggest that between 11% and 18% of drivers aged 75 and older who enter the enhanced fitness review process will not receive unrestricted renewal on their first application. That percentage, applied to the 19 million drivers facing renewal in the first 18 months, implies somewhere between 2.1 million and 3.4 million Americans will lose full driving privileges or face conditional restrictions by late 2027. Not because they caused accidents, not because they violated laws, because they triggered evaluation criteria in a system designed to narrow eligibility. None of this is being framed as prohibition. It is being framed as individualized safety assessment. But when individualized assessment is conducted through standardized algorithms applied to millions of people simultaneously, it is not individualized. It is mass categorization with a personalized notification letter. I have seen this structural pattern before in financial surveillance systems that claim to target suspicious activity but collect everyone's transactions. In immigration enforcement mechanisms that claim to prioritize dangerous individuals but build databases on entire populations. In public health frameworks that claim to protect vulnerable groups but establish monitoring infrastructure that never gets dismantled. The common thread is always the same. Build the system during a moment of perceived urgency, embed it in administrative procedure, expand it incrementally. And by the time anyone questions the scope, the system has been operational long enough that shutting it down would be described as reckless. The February 2026 implementation is being presented as a starting point. Federal guidance documents refer to it as Phase 1 of a multi-year roadmap toward what they are calling continuous fitness verification. According to unconfirmed reports from DOT working groups, later phases under consideration include annual recertification for all drivers over 70 mandatory telematics, monitoring through vehicle systems that report driving behavior directly to state databases, and biometric screening at renewal that includes reflex testing and neurological assessment. These are not approved policies. They are directional indicators and planning documents. But planning documents become policy when no structural opposition interrupts the progression. The state motor vehicle departments are not the origin of this shift. They are the enforcement layer. The regulatory authority came from federal agencies operating under statutory language written years ago with provisions vague enough to accommodate future expansion. The medical assessment requirements came from insurance industry actuarial models that treat age as a liability category. The database infrastructure came from technology vendors who built similar systems for criminal justice and immigration enforcement and are now adapting them for transportation administration. Every actor in the system is following their institutional incentives. No single decision feels like overreach, but the system they are collectively building will operate as centralized control over individual mobility, implemented through decentralized administrative discretion that is nearly impossible to challenge. You cannot sue an algorithm. You cannot cross-examine a database. You cannot appeal to a supervisor when the supervisor is following a procedural manual that was written to insulate decisions from reversal. The system is designed to be frictionless in one direction. Restriction flows smoothly. Restoration does not. I'm not warning you in time. I am documenting the moment the structure locked into place. By the time drivers aged 65 and older begin receiving their renewal notices in early 2026, the apparatus will already be operational. The training will be complete. The databases will be integrated. The fee structures will be in place. The conditional license framework will be ready to deploy. What was temporary procedure will have become permanent infrastructure, and the question of whether it should exist will have been replaced by the reality that it already does.